Hello and welcome to this video on the psychology of pandemics. This video is going to be doing something a little bit different in that I'm having a look at a book written by Stephen Taylor, who wrote the book on the psychology of pandemics, literally, titled Preparing for the Next Outbreak of Infectious Disease. And he goes over historical precedent in terms of the psychological outcomes of a pandemic. So this book was published some time ago, well before the current COVID-19 outbreak, and I wanted to compare his observations with what we've been experiencing in our own lives during this pandemic. He does start with a good note though, and says that most people are resilient to stress, and many survivors of highly stressful events will likely emerge psychologically unscathed. He argues in the book that the psychological footprint is likely to be larger than the medical footprint of the next pandemic, although he did think that it was an influenza-based pandemic, not a coronavirus-based pandemic, which, as you can see, a couple of days ago before posting this video, the people who have died from corona-related illnesses just topped 100,000. So there is definitely a large medical footprint, perhaps larger than was expected when he wrote the book. But what they mean about the psychological footprint is that the psychological effects of the next pandemic will likely be more pronounced, more widespread, and longer lasting than purely somatic or biological effects of the infection. An example of this was seen during the 2014-2015 Ebola outbreak in West Africa, in which the pandemic of fear was worse than the epidemic itself in terms of the number of people who were affected by it. Although many people will probably experience emotional distress during the next or current pandemic, the picture is more complex. People differ in how they react to psychosocial stresses such as threat of or an actual occurrence of a pandemic. Reactions can be diverse, ranging from fear to indifference to fatalistic acceptance. At one end of the spectrum, some people frankly disregard or deny the risks and fail to engage in recommended health behaviors such as vaccinations, hygiene practices, and social distancing. At the other end of the spectrum, many people react with intense anxiety or fear. A moderate level of fear or anxiety can motivate people to cope with health threats, but severe distress is debilitating. The fear of an impending pandemic can precede any pandemic and may have to be dealt with in addition to managing the pandemic itself. The surge of patients on hospitals can occur even when an outbreak is only a rumor. Consider a study conducted in Utah. At a time when there was a heightened public concern about influenza, but little disease prevalence in Utah, emergency room departments experienced substantial surges in patient volumes, with the volumes comparable to increases experienced when the disease actually reached the state. Most of the surge was due to pediatric visits. Young children frequently contact diseases with flu-like features, which were likely misinterpreted by their parents as possible signs of swine flu. Anxiety and fear become even more prevalent when the pandemic actually arrives. During the early stages of the 2009 swine flu pandemic, for instance, 24% of a UK community sample reported significant anxiety about the outbreak. In a survey of American college students during the early stages of the same pandemic, more than 83% reported at least some degree of anxiety about becoming infected. Some people may develop excessive fears of death and disability, while others may express fears of being shunned by others if they were to become ill. People who are highly anxious about being infected typically go to great lengths to protect themselves. This may involve avoidance of infection-related stimuli, including people, places, and things associated with disease. People may refuse to go to work for fear of coming in contact with infected others. During the Spanish flu pandemic, there were reports of sick, bedridden people starving to death because they were avoided by others. Avoidance or fearful removal of perceived sources of infection can extend to animals. For instance, during the 2003 SARS outbreak in China, there were widespread reports of household dogs and cats being abandoned, euthanized, or sometimes being beaten to death because of the fear that the animals might be carrying the SARS virus. Mental disorders can be triggered or exacerbated by pandemic-related stresses, including mood disorders, anxiety disorders, and PTSD. PTSD can be triggered by pandemic-related stresses such as exposure to widespread mortality, and including the deaths of loved ones. Depression or severe grief can occur in people who have lost loved ones during a pandemic, as recalled by one Spanish flu survivor. Every day there was someone we knew in the obituary columns. Severe guilt may occur if a person believes they should have saved loved ones or believes that they were somehow responsible for the spread of the disease. As the pandemic unfolds, some people adapt to the threat and become less anxious. However, in some cases the psychological effects can be severe and long-lasting. The author wrote that if the next pandemic proves to be highly lethal, which it is, and no available vaccines are effective, which they aren't, people desperate to protect themselves and loved ones will increasingly turn to quack cures and dubious folk remedies. There is a long history of such use for influenza, including wearing necklaces of garlic, inhaling carbolic acid vapors, and consuming pine tar. Similarly, during the 2003 SARS outbreak, there were numerous folk remedies, all of which were ineffective. These included diets of turnips, vinegar, kimchi or spicy food, and even smoking cigarettes. During the Spanish flu of 1918, folk remedies included cotton bags containing camphor worn on a card around the neck. In one instance, a Canadian man drank hydrogen peroxide in the hope of keeping himself safe from the Spanish flu. Another psychological effect of pandemics is mass panic. Mass panic is a group phenomenon in which intensely frightened people think only of themselves, causing harm to others as they struggle to save themselves. Mass panic and widespread antisocial behavior, such as rioting, looting, and the destruction of property, sometimes but not usually occur during pandemics. Supportive and pro-social behaviors are actually more common where widespread sickness and debility evoke acts of mutual aid among members of the community in crisis. There have also been many documented cases of panic buying. During an outbreak of avian flu, there was panic buying of food, disinfectants, and antiviral medication. In Baltimore during the Spanish flu pandemic, customers ravaged drugstores in search of products to prevent influenza and relieve symptoms. So we can see that the patterns of psychological reactions to pandemics are indeed complex. I think that the author was quite accurate on a lot of predictions, but also I think underrated the severity of the current pandemic in his predictions. I'm interested to know how you've been experiencing life under an unprecedented, at least in recent times, pandemic, and how you feel about the predictions and, well, the evidence in real life. Leave a comment and let me know. Thanks for watching, and keep safe.